Hi, everybody. Welcome to Facebook Live. And tonight we're going to be talking about the SECURE-IBD registry, updates on COVID-19 research from SECURE-IBD and IBD Partners. I'm Laura Wingate. I'm the Senior Vice President of Education, Support, and Advocacy for the Crohn's and Colitis Foundation. And I'm really thrilled to welcome Dr. Mike Kappelman, professor at the University of North Carolina School of Medicine and the co-PI for the SECURE-IBD registry. And I'd also like to welcome Dr. Millie Long, Associate Professor at University of North Carolina School of Medicine and co-investigator for IBD Partners. Thank you both for joining us this evening. I know everyone on the Facebook Live audience this evening is really eager to hear about the research that's being done with SECURE-IBD and IBD Partners and understanding how COVID-19 is impacting the IBD community. So thank you both for joining us this evening.
Glad to be here.
Very much so.
Thanks. I'd also like to thank our sponsors who are making all of our COVID-19 programs and resources available. Without their generous support, we would not be able to do all that we're doing, and we're so grateful for the support of AbbVie, Genentech, Gilead, Janssen, Shire, and Takeda for their support of these programs in Facebook Live, but all the resources you see on the Foundation's website. As a reminder, I want to remind our Facebook Live community this evening that the information we're providing during tonight's chat is meant for educational purposes only. This should not replace any advice you receive from your gastroenterologist, your nutritionist, your surgeon. And if you have questions specific to your care, please reach out to your healthcare provider. So with all of that said, Dr. Kappelman, I'd like to jump in with some questions about SECURE-IBD. And I'd like to first start with asking you to explain what the SECURE-IBD registry is and why it's important to the IBD community.
Absolutely. Thanks so much, Laura. So SECURE-IBD stands for Surveillance Epidemiology of Coronavirus under Research Exclusion for patients with inflammatory bowel disease. This is a project that has been jointly developed by our team at the University of North Carolina at Chapel Hill, as well as our colleagues at the Icahn School of Medicine at Mount Sinai in New York. Next slide. The purpose of SECURE-IBD is to rapidly define the impact of coronavirus on patients with IBD and understand how factors such as age, comorbidities, and importantly, IBD treatments affect the outcomes of coronavirus in patients who become infected. And really importantly, to openly share these findings with the IBD community, including the outcomes of COVID-19 broken down by patient age, gender, IBD treatments, and other factors. And as part of that open sharing of findings, it really is wonderful to be part of this program this evening. Next slide. So SECURE-IBD in a nutshell is both a database as well as the know-how to analyze that data, as well as a website for reporting. The database contains a web-based survey that is filled out by healthcare providers across the globe and captures data on patient geographic location, demographics, inflammatory bowel disease characteristics and treatments, other comorbidities, and coronavirus outcomes. All of these data are de-identified and are stored on secure encrypted servers at the University of North Carolina in Chapel Hill and are protected in accordance with HIPAA safe harbor standards. Next slide.
Dr. Kappelman, would you just pause for one moment? We seem to be having some visual difficulties. Rebecca, I'm going to ask you to let us know if they're resolved.
Sure, I am working on fixing that right now.
Perfect.
Thank you, Rebecca. So Dr. Kappelman, we'll just pause for a second to make sure that everyone can see the slides that you're sharing this evening.
No problem. And if the technical difficulties persist, I'm also happy to continue without slides. I believe that all of this will ultimately be posted. So just let me know.
We can easily post all the slides after tonight's program as well. So agreed, if we're not able to get the technology to function, we'll just put everybody else on camera again. We'll go without slides and then we'll post the slides afterwards.
Okay, it seems that people can see slides now.
Perfect. So I just finished giving everyone an overview of our database, which collects data from healthcare providers across the globe on both characteristics related to patients, their IBD and coronavirus outcomes. And all of that data is de-identified and safely stored on secure servers within the University of North Carolina at Chapel Hill. If you could advance to the next slide. The website is the other hallmark of the project. It serves as a externally facing landing page. It provides project information for not only healthcare providers and reporters, but also the patient community and caregiver community. This is where reporters can have direct access to report cases into the database. And is meant to facilitate the rapid sharing of our data. For any of you who want to go to the website, it's www.covidibd.org, all one word. And you can see our updated data refreshed on a weekly basis. And I'll go through some of those data reports later this call. It is also a link to other patient and provider resources, including the outstanding resources from the Crohn's and Colitis Foundation. And we acknowledge our many partnering organizations who help promote and spread the word about SECURE-IBD, as well as who have helped to fund this research project. Next slide. And so this registry is super important for inflammatory bowel disease because it really seeks to answer the questions that are on all of our minds, whether we be providers or patients or caregivers. What is the risk to IBD patients of coronavirus, and how do medications and other characteristics affect that risk? And I think importantly, the online format allows for rapid and free data sharing and breaks down the silos and barriers that typically exist between research and education. We've been able to combine those two into one seamless effort.
And Dr. Kappelman, how many cases have been entered to date? And can you tell us a bit more about where the cases are coming from?
Sure, and the next slide. So these are data as of Monday's report and data cleaning. We now have 1,170 reported cases of confirmed COVID amongst IBD patients. Strikingly, from 42 countries worldwide, about a third of patients are from the United States and 2/3 really from all over the world. The median age of reported cases is 45 years, 52% are male, and 56% have Crohn's disease. The next slide shows a map of where the reported cases have arisen. You can see the darker color in red in the United States is where about a third of the cases have come from, and most of the hotspots that you're aware of about coronavirus in general are also hotspots for the SECURE-IBD registry, Western Europe, Canada, and you can see a smattering of countries elsewhere. And the next slide shows the reporting of cases over time. You'll notice that Sadly enough, the number of reported cases continues to grow. We certainly have not reached a peak within our worldwide IBD community. And there, as I mentioned earlier, a slight predominance of Crohn's cases that have been reported to us, shown in the darker orange, compared to ulcerative colitis in the lighter yellow.
And from the data, which IBD patients seem to be doing the best when COVID-19 is contracted, and which patients are having more difficult recoveries or experiencing higher mortality?
So in the next slide, I'm going to orient you to a number of figures, and all of these are on our project website and are updated on a weekly basis. And you can see on the left-hand column a number of different characteristics. This slide here is focused on age. And up at the top, you can see total numbers, as well as the outcomes of coronavirus infection. And I'll turn your attention to the column where it says outpatient only. That's a good thing. Those are the mild cases of COVID-19 that don't require hospitalization or care in the intensive care unit or with a ventilator. And then I'll turn your attention to the columns on the right, the second to right column, death, and the far right column, which is a composite of either requiring an intensive care unit stay or ventilator support or death. And you can see on this slide here that there is a really profound effect of age within IBD patients, very similar to what we're seeing in the general population. You can look at the top two rows, age 0 to 9 and 10 to 19. So these are our pediatric patients, and across the board, all of the pediatric cases reported to date, now about 50 in total, have done exceptionally well. And as you march sort of lower and lower with increasing age, the outcomes of coronavirus become a bit more unfortunate, with higher proportions of patients dying or requiring a intensive care unit stay or ventilator. On the next slide. So this slide here shows outcomes by non-inflammatory bowel disease comorbidities. So things like diabetes, heart disease, obesity, other health conditions. And as you can see, the patients with no comorbidities do very well, and outcomes become worse with each increase in the number of comorbidities, non-IBD comorbidities that patients have.
And what have we been able to learn from the SECURE-IBD registry about IBD medications and COVID-19, Dr. Kappelman?
Yeah, so we're beginning to really learn a lot about medications in inflammatory bowel disease. And the next slide points to some of our early data. So again, this slide here breaks down the same outcomes using the same format as the other charts, by medication type that patients were on, either at the time that they were infected by coronavirus or within the prior 2 weeks. And I've circled two numbers here. I've circled the number of patients, or the percent of patients on oral steroids who have experienced our sort of most significant outcome of intensive care unit support or death. And patients on oral steroids seem to be at the highest risk of the more severe COVID outcomes. I've also circled the 2% associated with anti-TNF therapy. And I've highlighted that because of all of our reported cases, the greatest number have been on anti-TNF therapy. And those outcomes appear to be quite good. And so I think it's quite reassuring that, at least for this class of immunosuppressant medications, it doesn't seem to be a major risk factor for more severe COVID or worse COVID outcomes.
Dr. Kappelman, that's really reassuring news for so many in the IBD community. And I was recently reading a study published in the Journal of Gastroenterology by Dr. Rodriguez-Lago et al. And that study reported a good prognosis for IBD patients that developed COVID-19. Does the SECURE-IBD registry support the conclusion that IBD patients generally are recovering well from COVID-19?
I think so. I think our data to date, and really with increasing time and increasing numbers of cases reported to us, from all over the globe, we really are observing that IBD patients do fairly well if affected by COVID. Next slide. And so I think the takeaway points are, mortality amongst IBD patients overall is about 4%, which is really not much different than what you'll see reported by the Centers for Disease Control and other websites. Maybe a little bit of a higher risk for inflammatory bowel disease patients as a whole, but nowhere near as scary as many of us thought it was going to be back in February when we knew that this was coming. And importantly, there have been no deaths observed in patients less than 20 years of age. Again, not all patients are the same. There's a lot of factors involved in the prognosis of COVID. In addition to age, it does appear that oral steroids or systemic steroids seem to be a risk factor for worse outcomes, but many of the other treatments utilized do appear to be safe in the setting of this pandemic. We definitely need more data and further analyses to more fully evaluate other classes of medication. But by and large, these emerging data support the earlier recommendations from many experts and the recommendations that have been on the Crohn's and Colitis Foundation website from the beginning, that it's really important to continue inflammatory bowel disease medications in healthy patients who have not been affected by COVID. In other words, don't stop medications for fear of COVID. Stay on medications by and large because it's important to control the inflammatory bowel disease. For infected patients, it probably is worth a call to the gastroenterologist or prescribing physician to discuss the pros and cons of a temporary hold of medications during the recovery period. And I think in my final slide, I just wanted to acknowledge that this is an amazing effort. We have partnering organizations across the globe that have helped to promote and support this study. The Crohn's and Colitis Foundation was our very first official partner. And we also have a number of funders, including the Helmsley Charitable Trust and a multi-pharmaceutical sponsorship, as well as the University of North Carolina at Chapel Hill.
And Dr. Kappelman, I think everyone is really reassured by this data, and I can imagine we're going to continue to have you and the investigators from SECURE-IBD update us as the data set continues to grow and we learn even more about COVID-19 and the IBD community. So thank you for sharing your insights with us this evening.
My pleasure.
I'd now like to talk to Dr. Long and have you help us understand what IBD Partners is doing. I understand that IBD Partners has issued a COVID-19 survey, and can you explain to us what IBD Partners is and why this is an important effort to the IBD community?
Absolutely. Thank you so much, Laura, for starting us off. I think let me go into the next slide as we talk a little bit about what IBD Partners is for those of you that aren't aware of this initiative. And so IBD Partners has actually been around since 2011. Actually, Dr. Kappelman and I helped launch this back then. So we have almost 9 years of data. And what it is it's a group of patients that fill out regular surveys. The standard surveys are every 6 months. And anyone from around the world can join this survey study. We actually have over 15,000 patients with inflammatory bowel disease already enrolled who've been filling out surveys for up to 9 years. We capture data on things like exposures, on health behaviors, on outcomes. And people can even link things like their devices. So we can understand how sleep may play a role with flares or how exercise may play a role. And really this internet-based platform really supports a diverse array of studies. So not only can we do studies within the platform, but we know some information about the patients who are participants, and we can let them know about other studies that they may be eligible for. And so this really helps to increase the ability for patients to participate in research. And I think most importantly is it really allows for a partnership between patients and researchers and the foundation to really try to improve outcomes. So next slide. So this is kind of our model for how we developed IBD Partners, kind of thinking about almost a triangle, once the slide does move forward, where we have the patient community, the foundation, and researchers all working together to answer questions that are important to patients. So next slide. So we really think that this is the future of IBD research. The internet really allows for participation for anyone that has a phone or a tablet or a computer. And we can really also ask questions to patients about what they want us to study. It's collaborative and open access, and so any investigator can participate. They can apply to do a study within IBD Partners, and often we actually pair them with a patient who has proposed a research idea. We've had over 50 researchers from various institutions across the country that have participated. And we've had a lot of different funding as well, including federal funding agencies. We've had collaborations with industry for investigator-initiated projects, really using real-world data, because these are data that show how patients are living every day and what medications they're using, and they're stopping and having side effects or improving. We're capturing all of that through those surveys. But one thing that I think is really unique about Partners is that we can also do really important studies by recruiting from within the membership. And so I don't know if many of you have heard about this great study that just concluded called DINE Crohn's disease, DINE CD. And it was a study that came out of a question a patient on our platform asked about the specific carbohydrate diet. And this was a huge national study investigating the specific carbohydrate diet, or a Mediterranean diet. And patients were actually catered all of their meals. We were able to measure outcomes like stool studies showing inflammation. And so it's really the first study of its kind to really look at diet. And it all came about because of IBD Partners. We don't have the results of that yet. Please invite me back once we do. And Jim Lewis, who's the lead PI there, I know will be happy to share that study just finished enrolling. But it's just an example of how IBD Partners can really be the future of IBD research. So next slide. And so how does it work? We invite patients from email rosters. We certainly have links from the foundation webpage, social media, walks. For example, I'm an adult gastroenterologist, and I recruit patients from my clinic. I tell them about this as an opportunity to participate in research right from their home. You know, and they fill out surveys, things like how old they are, if they have any other medical problems, the characteristics of their Crohn's disease or ulcerative colitis, importantly, what medications they're on, what their quality of life is like. And we ask them very specific questions that correlate with disease activity, so we can see how active their Crohn's disease and ulcerative colitis is. And then at follow-up surveys, which are done every 6 months, we recapture some of this information. And we have a real focus on some things that patients have told us are very important, that perhaps these may be some of the most important outcomes. Things like pain, fatigue, sleep, physical function, emotional distress, social support. So not only those bowel-related symptoms, but some of these other things that many of our patient collaborators have told us are very important to them. Patients can also log on as often as daily and fill out kind of brief updates if something changes associated with their Crohn's disease or ulcerative colitis. And again, I mentioned that you can even sync apps and kind of generate a dashboard, and so you can see how things like sleep or physical activity affect outcomes for you, and then more broadly across populations. That's what we're studying in IBD Partners. So next slide. And so again, this is just a picture from our website that shows kind of where patients are located. We actually have people all over the world. We actually have at least one IBD partner in every state in the United States, which is wonderful. So it's really a quite diverse group. And we're continuing to grow each and every year, which is really important to us as we try to really understand more broadly what it's like to live with inflammatory bowel disease. So as you can probably imagine, this is a great platform to study something like COVID that may be affecting people differently in different parts of the US, for example, so that we can understand kind of what it's like for people even within their own areas. Next slide. And so when in IBD Partners, patients pose questions. And so, you know, for example, questions on diet, that first question, questions on probiotics. And these are things that we then ask researchers to go and study. The role of stress, symptoms associated with dairy or not eating dairy. But, you know, one of the more important questions posed recently is really, how is COVID-19 affecting IBD patients? Mm-hmm. What are the risks of COVID-19 for IBD patients? I think Dr. Kappelman just went through some amazing data out of the SECURE-IBD registry, which is data that's reported by physicians about what's happening to patients. What we can do within IBD Partners is understand data reported by patients about what's happening to them. And this may allow us to catch data on patients who may have milder symptoms that didn't land in the hospital, or patients who didn't have access to testing, didn't necessarily test positive, but had the symptoms of COVID. So we can help to really round out a lot of this information. So not only are we collecting it from the physicians, but also collecting it from the patients, which also allows us to get at other important aspects, like whether they can continue to get their medications or have access to visiting their doctor, all of these things that may be different in different parts of the country. So next slide.
Well, and Dr. Long, I think you bring up a really good point that the patients, the data you're gathering is really different in IBD Partners. Can you tell us more about the data that you're gathering?
Sure. Yeah, no, absolutely. And so, you know, while, you know, obviously Dr. Kappelman's data is outstanding and really focuses a lot on hospitalization and ventilator use and some of those hard outcomes, we're looking at a lot of different outcomes. And so we're asking questions. What can happen is through IBD Partners, you can sign up for these COVID surveys. You know, remember I mentioned that regular surveys are every 6 months, but these are every 2 weeks for about 2 months, just to help us to try to get to understand how things are changing and how they may be changing rapidly in your area in regards to COVID. So we ask questions on symptoms, on diagnosis, on whether or not someone has been tested, as well as kind of general knowledge about resources in their area for testing. We do collect data on medication use and kind of how active someone's Crohn's disease or ulcerative colitis is. But we're also trying to get at whether patients can even get to the doctor. Do they have access to telemedicine, medications, refills? Can they even get to infusions? Are there infusion suites open? We also want to understand the level of concern that IBD patients have, both for developing COVID and also for concerns surrounding particular medications. But then there are also a lot of other factors that could be significantly affecting patients with inflammatory bowel disease, just as they're affecting everyone across the US. So are people losing employment? Obviously, that means a lot for a patient with IBD. If they lose employment, they could lose insurance and coverage of medications. And so we need to understand this to try to help to have the right advocacy to help these patients. Mm-hmm. And then we're also trying to track real-time cases in the states throughout the United States. And so I'll show you later on kind of an innovative interactive map we've come up with to really track patients within IBD Partners. really the goal of this is to report information back to patients. So we're going to provide summaries, hopefully every couple of weeks as we get new data, and also maps that are available on the IBD Partners website. So next slide. So I just wanted to share a little bit of the data with you all and of what we have seen thus far. This is the first sample of almost 1,500 patients who've completed these surveys within Partners. The average age was about 49. We have a little bit more women than men who filled out this survey. All of these patients have inflammatory bowel disease. As you look down, many have had a prior surgery. Many have had a prior hospitalization for inflammatory bowel disease. When you look at medications, about a third are on those anti-TNF medications. I saw in the chat, those are some of those medications like Remicade or Inflectra that people are commenting that they're on. The immunomodulator use, those are things like azathioprine or 6-MP. Steroids, we just saw that in SECURE-IBD, steroids were a big risk factor for potentially having complications from COVID. We've got a reasonable number of patients on steroids and also on 5-ASA or mesalamine. We looked at some measures of disease activity, and most of these patients are in remission. Most of them have these disease activity scores that are in those ranges consistent with less active disease. And we even measured some things like anxiety levels. And those anxiety levels are actually, this was data kind of at the beginning of this. The anxiety levels were actually kind of on par with what one would expect in the general population. But just kind of a snapshot of information surrounding the patients included. So next slide. And so we really wanted to kind of focus on a lot of these areas, such as concerns about COVID. I just wanted to have you focus on the red and the black here. And on the left-hand side, when these patients with inflammatory bowel disease were asked how concerned they are about COVID, the red is extremely and the black is moderately. And so obviously there's a huge level of concern amongst this patient population. And there's a lot of concern, as you can see, again, red and black with the right panel, the right pie chart there, that about medications. And that's why I think initiatives like this and also initiatives like SECURE-IBD are so important, so we can provide as much information as possible about the medications folks are on and whether they need to continue them or what those risks are. And so we hear this level of concern, and that's why we're doing this work. Next slide. We were wondering what the pandemic has done in terms of ways you have had to alter your healthcare pattern. We know it's very important in terms of checkups and labs, colonoscopies, testing, getting your infusions, and who has had delays associated with that or avoiding those interactions, because certainly that could impact things down the road. And so the biggest group is that many patients are avoiding going to their primary care physician's office. And obviously, I think that is related to the fact that many sick people go to primary care physician's office. About 20% have missed a colonoscopy. About a quarter have avoided labs. Smaller numbers have avoided or delayed infusions, but there's still a reasonable number there, about 9% between those two. And one of the things we know about infusion-based medications is that if they're delayed or skipped, people can develop antibodies, and so they may not be as effective down the road. So that's a really important thing if patients aren't able to get to their infusions. And then about a quarter of patients were also avoiding going to the GI office. And so this makes us realize that we need to provide more remote resources for our patients. So next slide. This next slide has to do with avoiding environmental factors, and just nearly universally, people are avoiding seeing friends and family, avoiding restaurants, stores, leaving the house. And so, I think that many of us have taken these stay-at-home orders incredibly seriously, and this shows that people within the IBD population have done so as well. Next slide. And one of the things we thought was really important to look at was access to telehealth, because this could be an avenue where patients could stay connected with their providers and help to continue to optimize care even remotely in a scenario like this where so many patients aren't leaving their homes. And I was actually really heartened to see these numbers in that nearly 80% of IBD patients' doctor's offices are actually offering telehealth. That's actually higher than I anticipated. And so that, while I wish it were 100, that certainly gives me hope that people are potentially going to be able to access some care even remotely. And almost half of the patients surveyed had already had a telehealth visit in regards to kind of maintenance of their inflammatory bowel disease. We also asked about where patients were getting information about COVID-19. I think everyone on this call recognizes that there are a lot of different resources for information, some of which may be more accurate than others. And really, as you look, patients are getting some information from their GI physician, but really a lot is coming from the CDC, which is a great website and resource, from news media, from social media, Crohn's and Colitis Foundation website, and then a myriad of other arenas, but really trying to find what those sources are so we can make sure good information is out there. Next slide.
And Dr. Long, before we move into discussing employment, the information you're sharing is so important. And as a health educator and an advocate, I'm really interested in the data you're sharing because it will help inform not only the educational resources, but also the advocacy that the foundation engages in. And I really want to hear more about the employment and the health insurance coverage that you were able to ask our patients. So I look forward to hearing what you have to share on the IBD Partners survey here.
Yes, absolutely, Laura. And I think that, again, that's so important. And one of the things that's great about this project is, as patients, like your patients who are commenting with some great comments, are able to weigh in, we have the ability to modify this, so we can ask more and more questions as this pandemic changes, to help to not only understand other avenues we could advocate for our patients to get them access to care, but really everything from now asking about antibody testing, not just testing for COVID. I mean, we're getting so much feedback that we're kind of making this a living survey, so to speak, so we can continue to modify it. One of the areas we wanted to start with and plan to keep asking about is employment status and health insurance, because one of the things I have noticed is that for some of my patients, unfortunately, just due to the nature of their work, they have lost their jobs and or had dramatic changes in their jobs, reduction in hours such that they're not taking home the same paychecks. And this really dramatically impacts your ability to manage a chronic disease, quite obviously. And so it opens up an arena, as you mentioned, for the foundation and others to try to help from an advocacy standpoint, from resources, getting access to free medications, things like that. So I think these data are really important. Just early on in this pandemic, with these 1,500 people, about 5% had already been laid off, 9% reduced hours. A lot of patients have switched nearly entirely to working from home, nearly 40%. A smaller number have changed jobs, and about 7% said their responsibilities have changed. I think, as this evolves, I hope that we won't see bigger numbers in this, but it's certainly something we need to track, because we need to, as you mentioned, really try to advocate for our patients and for resources for them. In terms of health insurance, I was actually very thankful to see that that's actually quite low at this point. But obviously, even the few that are impacted, it's pretty dramatic. Lost health insurance, about 0.2%, change 0.4%, and other 0.5%. This is something we'll continue to monitor, Laura.
Yeah, and it's something the foundation has worked very hard in compiling resources to ensure that we have a landing place where, whether it's the federal resources, the state resources, or even food assistance programs, that they're all located on the foundation's web pages. So as this data becomes more robust, as you continue to add to it, I think linking these resources to this data will be so important to the IBD community. I would also like to hear what you've learned about the sickness and the severity of illness through IBD Partners.
Yes, absolutely. Getting to the meat of the symptoms and the diagnosis. Yeah, let's move on to the next slide. There's just such a wealth of information that people are sharing with us. These are some of the data about reporting sickness. And by sickness, it's a variety of symptoms. We're asking even down to, I saw some of the questions on the chat, if it's nasal congestion, if it's cough, if it's, we're actually starting to see some GI symptoms associated with COVID, really capturing what are those particular individual symptoms. But of these 1,500 people, about a third reported becoming sick with some symptoms or another that could be consistent with COVID. But only a small fraction had actually been tested, about 4%. And about 3% had confirmed contact with someone who had tested positives. We had very low numbers of patients as of this time point. Obviously, things are changing, who had actually kind of confirmed positive PCR testing, meaning the nasal swab active viral replication. But we had others who had symptoms consistent with COVID, whose doctors had told them, "You've got COVID, I just can't test you," and who had stayed home. About 54 patients, or 4%, had stopped a medication when they were sick. Meaning, as Dr. Kappelman had mentioned earlier, that sometimes in consultation with your doctor, if you are sick, you'll actually hold some of those medications for a brief time period. But we obviously need to continue to follow these patients to make sure to see if that actually has an impact on their IBD management down the road. When you look at those that had reported any degree of sickness, the vast majority were in the range of very mild to moderate, with a very small number of patients, actually only a total of 7%, reporting severe or very severe symptoms. And again, not all of these patients had COVID, but they just all had symptoms. And again, because of limiting testing, we don't know how many of them actually did have COVID. Next slide. And so one of the things that we're sharing with our patients in the IBD Partners community is actually an interactive map. And what on this map, this is just a screenshot of it. It's not interactive, but for our participants, it is. And you can actually hover over every state, and it'll tell you how many patients completed a survey in that state, how many had reported they were sick, how many got tested, how many had had contact with a patient who had tested positive, how many had been diagnosed with COVID, and then finally, how many had been diagnosed with COVID and also recovered. And Laura, I think you had asked me earlier, well, which states are the hot spots? Well, so this is a kind of a heat map, and you can kind of tell that New York and California seem to have the highest rates thus far of patients who have become sick with symptoms. And obviously, that's similar to what we're hearing in the media in terms of rates of infection. And it seems to be somewhat similar for our patients with IBD, remembering that all of these patients do have inflammatory bowel disease.
Yeah, it's interesting to see how this data mirrors the national data in so many ways. And I'm wondering what you've learned about IBD medications, and are there findings similar to anything that Dr. Kappelman shared?
At this point, we have small enough numbers that we haven't seen anything different or striking. I think that as we continue to accrue data, we'll have more and more numbers that will help us to reach some of those conclusions. And again, one of the advantages here is we also have patients who have the milder symptoms. We have the whole gamut because it's actually coming straight from the patient. Mm-hmm. And I do want to emphasize that this survey is continuing to recruit. IBD Partners is continuing to recruit. And so anyone who would be interested in participating, we would love to have you. These are not necessarily patients that were chosen for this. These are patients who have joined IBD Partners and want to fill out surveys and participate. And again, we hope to continue to grow this.
And can you tell me more about the intersection between IBD course and IBD plexus? I understand both of these IBD programs that the foundation supports are also leveraging this survey to learn about the IBD community. Can you tell us a bit more about that, Dr. Long?
Yes, absolutely. And so I think as I was mentioning, we really do need large numbers to help to see, because when you have large numbers, a smaller percentage will become sick, and then we can start to look at some of these differences. And so one of the wonderful things that the foundation has done is they lead a number of different studies, a number of different what we call cohorts that are observational studies following patients with inflammatory bowel disease over time. One is called the SPARK cohort, and that's based out of a lot of different centers that care for inflammatory bowel disease patients. And then the CHORUS cohort, which is a quality improvement cohort that the foundation has developed in centers and clinics all over the United States. And so patients in both of those cohorts have also been asked to participate in this survey, again, to allow us to capture as many patients as possible. They do so electronically, from the comfort of their own home. And I don't have those data here, I was just showing the IBD Partners data, but each of those surveys has over 1,000 patients who have participated as well. So as we pull these data together, we're really going to be able to learn a lot.
That's very impressive. And I do, like I said for Dr. Kappelman, I look forward to having you join us again to share updated data from both IBD Partners and CHORUS and SPARK so that we're able to continue to advance our community's knowledge. Dr. Long, is there anything else that you'd like to share?
I don't think so. I don't know that I remember what my next slide was. Maybe it was just a thank you slide.
I think we might have a summary slide.
Okay. These are just some information about medication changes. Again, trying to get out our patients stopping their medications due to concerns about COVID. And at this point, that number is very low, in accord with recommendations that say that patients should really stay on medications if they can in terms of management of their inflammatory bowel disease, especially given some of the data that Dr. Kappelman has shown us about, lack of significant risks other than with corticosteroids. So next slide, I think I do have a summary slide coming up. There we go. So in summary, from what we've learned thus far, and again, we'll continue to study patients through IBD Partners and our other cohorts, IBD patients are extremely concerned about COVID-19 risks, both generally and also the medication-specific risks. I think everyone on this program right now recognizes that. But that patients are also avoiding many health-related activities like labs, procedures, even infusions. And we need to try to understand if that's going to have any consequences downstream on their inflammatory bowel disease. We need to get them access to remote care. Nearly all IBD patients are self-isolating, and about half of patients have accessed telehealth. We want that number to go up. Many patients have had work-related changes, the biggest one being working from home. A minority have been laid off, but a majority have retained health insurance. Many patients have reported sickness symptoms over this time period, but only a small minority have been tested. Some patients have stopped medications due to concerns for COVID-19. But I think importantly, as you had mentioned, Laura, that continued surveys will allow us to track rates real time across the country to really better inform the IBD community.
And I think there's one last slide.
Yes, just a thank you from our multidisciplinary IBD Center at UNC that Mike and I are both a part of.
And I love that slide because I believe, Dr. Long, you are in one of those pictures. So
I know, except now if I'm doing a colonoscopy, I'm wearing a lot more protective equipment. So don't worry about that.
Well, I really want to thank both Dr. Kappelman and Dr. Long for their presentations this evening. I think a lot of the information that you have shared with us this evening has been really reassuring to our IBD community. And I know there's still a lot of unanswered questions. There's still a lot of data that we need to collect to fully understand all the implications of COVID-19 on our community. But I am really grateful for the work that you're both doing to get that data and to understand the impact on the IBD community. And I appreciate you taking the time this evening to share this data with all of us. And I once again would like to thank our sponsors for our COVID-19 resources. We are really grateful for the support that they have shown the foundation, and our sponsors are AbbVie, Genentech, Gilead, Janssen, Shire, and Takeda. And I wanted to just remind everyone on the call this evening that if you have questions that maybe weren't answered this evening, please visit the IBD Help Center. You can call us at 888-694-8872, extension number 8, or email us at info@Crohn'sColitisFoundation.org. You can also chat live with the specialist Monday, Tuesday, and Thursday from 9 a.m. to 5 p.m. Eastern. And the questions that maybe didn't get answered this evening, we are able to address those through the IBD Help Center, or you can also visit the COVID-19 resources on the foundation's website at Crohn'sColitisFoundation.org. At the very top of our page, you'll see a link to the COVID-19 resources. We are updating those resources weekly as new information comes out from SECURE or IBD Partners or other new findings. We are updating the information to make sure the IBD community stays informed and has all the information that is needed. I also want to encourage all of you to join us on Saturday, June 20th. We are hosting our virtual Take Steps walk. And you can learn more about joining us for our virtual walk at cctakesteps.org. And I'll be walking virtually with you, and I look forward to seeing you all there. And lastly, if you've enjoyed the session this evening and learned valuable information, I hope you'll share this recording with your friends, your family, and others who are impacted by inflammatory bowel disease. We're here to help, and we want you to share this information. And we also want to continue to serve the IBD community with programs like this and other mission-critical education and support programs. These are challenging times for all nonprofits, and we are struggling to raise funds too. And if you can, we hope you will consider making a contribution today to continue to support programs like this and our mission-critical activities of the foundation. And lastly, I want to thank you all for joining us this evening, and I hope you are all well and take care. Thank you.